But before I come to my slide, I want to explain the heart attack with an example. For example, at home, كبر من السعودية أو الردافة ساكن بكرة بدرس تجمع معك زور ساكن بيه أو كزور كود تعالي لنقص ولا كلام بتاعي. I think and it's the same mechanism for the arteries when a lot of accumulation fat is in the artery and the blood cannot pass easily, and then it will cause a heart attack. And the first type of MI is because of a rupture of the artery, fissure or dissection. The second type is due to high level of oxygen or decreased supply, because as we all know, the heart is living doing its normal functions with blood supplies, most importantly with the potassium. And also the potassium is very essential for the functions of heart. The third type is happening due to myocardial ischemia. So ischemia means inadequate blood supply to the heart. The fourth type is due because of coronary intervention or stent thrombosis. The stent thrombosis, we call it castarovalum. Sometimes it's failed after the procedure. Maybe again the patient will experience the same symptoms or with the lighter symptoms. Type 5 of MI is because of the cardiac surgery. We can say not all the heart surgeries are successful. There are cases that they might feel also, they might cause heart attack again. And the injury, sometimes because of inadequate of troponin and also not caring for the screening either due to the patient's case, monthly or 6 months once, maybe it will cause the MI injury. And we have diagnosis of MI. So heart attack does not have only one symptom or one type of diagnosis, because we have a very important symptom, which is chest pain. Chest pain is one of the most dangerous symptoms for heart attack generally, and also due to other diseases we may feel the chest pain. For example, in the GERD, for example, in gastroesophageal reflux disease, we might feel our chest is hurting, but it's not due to a heart attack. It's just due to the reflex of the acid in your stomach. Or, for example, the heart palpitation. When you're getting too tired or you have some dysfunctionality for your heart, you may feel the chest pain, but it's not directly linked to the heart attack, because it takes time for the heart attack to happen. And also, there are other factors that are affecting it, like for example, blood pressure, pulse, temperature. Especially when these patients that they have blood pressure disease, they are more at a high risk. And we have several tests, like for example, X-ray, blood tests, echocardiogram, ECG or EKG. Angiogram, CT, MRI, we can use these to diagnose the heart attack. The complications, not only when you have an MI, that's just with the MI. Of course, we had other complications like papillary muscle rupture, ventricular septal defect, pseudoaneurysm, and free wall rupture. And we have preventions for MI. Generally, as you all know, maintaining a healthy lifestyle is one of the best prevention generally for all diseases and especially for the MI. Managing chronic conditions, when people have some chronic conditions like, for example, diabetes or high blood pressure or anything else, they have to pay so much attention to their health and regulating their weight, practicing their stress management as much as possible, and schedule regular health screening, not neglect about their health screening and also the blood tests that they're required to do. And when the physician is prescribing the medication for the patient, they should use it properly, because if they don't use it and they say, I'll just get well by my own, it's not right. You have to take all the medications prescribed by a physician. and you have to be aware of the emergency symptoms. Also, if you're living with your family or at your workplace, let other people know about simple basic life supports for heart attacks. And also the best thing is to call ambulance if possible, because we may have some basic life support for other diseases, but it's not always the right thing for the heart attack, because it's something that we cannot directly fix it. Also, we have related diseases to MI. As I talked about, not only the complications, we have other diseases that's related to the MI. For example, bone cancer, atherosclerosis, chronic fatigue syndrome, cirrhosis, colorectal cancer, congestive heart failure, diabetes, endocarditis. Thank you so much.